Our feeling is that AML falls behind other blood cancers. We feel that we haven't seen the medical advances in research that other areas have had, and so this means we've got less new and innovative targeted therapies for this patient population. And I think this has probably had a knock-on effect that we actually have less patient services available for this patient population. There is a feeling that across the community, I think, that AML lags behind a bit. The lack of knowledge around AML and blood cancers as a whole, it can come as a real shock to them to find that they've been diagnosed and suddenly being rushed to hospital and being told that they were potentially hours or days away from dying had it not been picked up. So we found the speed of onset to be really difficult for patients to understand, and also with all blood cancers, they're relatively low patient numbers. Compared to other cancers where you may get a diagnosis, go home, do some online investigation, and it might be 2 to 3 weeks before you have to go to your next appointment. With AML, because they are in treatment so fast, and when they're going through treatment, they probably don't really feel like looking at anything on the internet, let alone healthcare information. So we do find that it can often be carers who are taking the lead on that. I think from our perspective, the two best sources of support for patients, firstly is having a specific named healthcare professional to look after your care. But patients are going to need support and information from a number of different sources. They're going to be treated in a number of different parts of healthcare, and to have one central person who can answer all their questions on clinical care, on the emotional side, talk to their families, talk to them about practical lifestyle issues is really important. The second is an obvious one, but it's access to the right information. We've heard from many AML patients who talk about being lost in a maze and metaphors like that, so anything that can help guide them through is really useful.